So Health Canada just approved this antibody test. An antibody is how your body reacts to an infection. This test that's just been licensed isn't in the hands of local physicians yet. It has to be approved by the province, then it has to get funded, and then it has to be available through your local laboratory. So it's going to be a long ways off until it's the hands of frontline workers that to use as a tool in our armamentarium to protect the health of our community. The test is a test of whether you've been exposed, and for it to turn positive, it really would depend on you developing that antibody, and it takes at least 2 weeks. It may take even 4 or 6 weeks in some individuals to develop a positive antibody test. So it will not be helpful for acute diagnosis. It will be very helpful to document that you've been exposed to this virus, and it doesn't tell us whether you have immunity because we just don't know that yet. It has been approved by Health Canada. It then has to get approved for use by each province and territory. It then would be used by private laboratories and public laboratories. All of that takes time. It has to be implemented in a phased approach to ensure that the test is reliable and accurate and helpful at the front line. And it really would be only for those that think they got exposed and earlier before they had the nasal test available, and for population studies where we'd be looking for what proportion of our population has some exposure prior to this virus, and to help us understand if our population develops immunity. So it's still in that aspect a research component. So it will take time, but it's important to realize that this is not a test that can help acutely. It will only tell you 4, 6, 8 weeks later that you've been exposed and built up these antibodies, and it does not necessarily correlate with immunity.